Okay, everyone, we are here with Lanre Tunji-Ajayi. My name is Chadwick Leonard. I am the executive director of Conquering the Curve Incorporated. We are so excited to have Lanre with us here today. Lanre is the interim president for the Global Alliance of Sickle Cell Disease Organizations. Before that, she was actually the founder of the Sickle Cell Awareness Group of Ontario. So we are excited to have her here today. We're going to be talking about the global perspective and the global needs of sickle cell disease and sickle cell trait. At this point, I'll turn it over to Lanre so she can introduce herself.
Thank you, Chadwick. And it's a pleasure being here with you and with your audience. As you rightly said, I'm the interim president of the Global Alliance of Sickle Cell Disease Organizations. Also like you mentioned, I also support Sickle Cell Awareness Group of Ontario. I co-founded this organization. In my journey, I have worked and dealt with a lot of individuals in the sickle cell disease space, nationally in Canada and also globally all over the world, including Africa, India, in the Caribbeans, just all over. Again, we live in a global village, and so we work all across, the world. Thank you again for having me, on your platform.
Yes, thank you for being here. I want to ask you, tell us a little bit about how you got into the work of the great advocacy that you do on such a wide level. Like, what started your passion for sickle cell disease?
Well, for me, I would say that advocacy was thrust on my laps. Being born in a family that is very much affected by sickle cell disease. In 1999, I lost my brother, and who was my best friend, to the complications of sickle cell disease. And I believe 5 years after, I felt and I thought there's something I can do to, you know, raise awareness and help other people. And in 2005, that was what gave birth to the Sickle Cell Awareness Group of Ontario. And seeing the needs, even in a country as advanced as Canada, it was just overwhelming. Initially, I was going to do something for 1 year and just move on with my life. But with the needs that were presented by the families in our country, Canada, I just have to keep going. And it was great that I had many people around me supporting me, the care providers, the caregivers, the individuals with sickle cell disease themselves, and the industry wanted me to move forward because they see the impact that the organization was making in the country. And so, believe it, that we didn't have any national organization in Canada. And so in 2012, myself and some advocates came together that we needed to have a national group. So we formed the Sickle Cell Association in Canada, and they asked me at that time to support as the president and CEO, and I was in that position for 5 years, right? So the Sickle Cell Disease Association of Canada was, given birth to in 2012, and the organization has been impactful in ensuring that we have newborn screening. While I was the national president, almost every province in this country was able to implement newborn screening. We were able to make June 19 as law. I know in many parts of the world it's celebrated, but in Canada it's actually the law, whereby the law was passed in our House of Commons that every June 19 awareness must be raised around sickle cell disease. So these are some of the works that I was able to do in terms of at the national level in Canada. And then when the opportunity presented itself to also serve at the global level, I offered to support. And that's why I am where I am. supporting the foundation. Let's put it that way. It's a very young and new organization. It's at the foundational level, to be able to ensure that we have a good structure for the global organization. And that is what I've been able to support and continue to support the organization in this role. Thank you.
That's an amazing story, and just once again, just thank you for all the work that you do in the space. And I'm glad you segued into um, the Global Alliance. Talk to us more about the reason for the founding of the Global Alliance and some of the core things that you that organization seeks to get done.
Wonderful. Thank you, Chadwick. So, as you know, sickle cell disease is predominantly in the sub Saharan Africa, in India, Saudi Arabia, those parts of the world. We know that high prevalence of sickle cell disease is in the low and medium resource countries of the world. This is where they may not have a lot of money in terms of programs and support and treatment, but they do have the numbers. And yet you find in other parts of the world, like in North America here, there's just a lot of resources that we have access to, and we don't even have that many patients. In Canada, we have about 6,000 patients. And in the US, I would say maybe about 100,000 patients with sickle cell disease. Yet you find in Nigeria, every year, about 150,000 babies are born every year, just every year. Just imagine the population of individuals with sickle cell disease in that country. So how do we bridge the gap between the high resource and the low resource? How do we exchange knowledge translation? How do we support advocacy to ensure that every individual with sickle cell disease, no matter where they live in the world, has access to equitable care, right? So to get that, that is what the Global Advocates, we came together on March 15, 2019, in a meeting in London, courtesy of Novartis, and we discussed different issues, global issues around sickle cell disease, but we also spoke about the need for a global patient organization. So this organization its main focus will be to work with the national and regional level organizations to advance the cause of sickle cell disease globally. In addition, we also want to connect the local groups, right, with the national groups, connect individuals with the local groups. It's on a chain. So GASDO, as we call it, the acronym, the Global Alliance of Sickle Cell Disease Organization, is a place for everybody, as individuals, as volunteers, as advocates, as local organizations, as national organizations, as regional sickle cell organizations, has even we are encouraging care provider organizations to be part of what we're doing, industry partners, because together we can move global advocacy for sickle cell disease forward. Because currently, as I said earlier, a lot of people in the low resource countries are suffering. Children are dying before the age of 5. There is no access to very simple disease modifying therapies and treatment, including hydroxyurea for many people. And so the only way we can help to bring this to happen is to have that global unified organization that will support groups all across the world to bring advocacy to where it needs to be.
Yeah, that is, not only is that amazing work, but I think it's ambitious work, which is what we need for the sickle cell community. Me not having sickle cell myself, but understanding what it is about because of organizations like yours and igniting my passion and continuing to um, do the work that we do at Conquering the Curve. I think that, a global organization and a global voice is something that can definitely push the community forward and continue to push the community forward. Because as we know, with World Sickle Cell Day coming up, that was instituted and decided on by by the United Nations. And so I think that that was a great move, but we can stand and still have to keep going and still have more movement around that. With that being said, can you talk about in the low to middle income companies, what is the most basic need that people living with sickle cell require there? What is the most basic thing that would help them in the most immediate way at this point?
So I would like to say, for instance, in many of these countries, there is no access to, equitable care and treatment. You find that, for instance, in Sierra Leone, I just got a call this morning from Sierra Leone in West Africa. There is no center of excellence. There is no center of excellence there. So there is no specialized center to take care of individuals with sickle cell disease in this place. You find that, and you also find something that's very interesting, Chadwick, is that in many of these countries, there is no national sickle cell organizations. So let me start with that. Because there is no national sickle cell organizations, you will notice that advocacy is not cohesive. You'll find that people are like the different groups are doing their own thing. It's very competing. Advocacy efforts are competing. And with the governments, once they see there is no unified voice, they will choose to ignore. They will choose to ignore. And so one of the things that I feel are lacking in many of these countries is that national voice. So it's part of the work of GASDO to ensure that every country has a national voice representing itself. And we will be able to work with that national organization in pushing forward effective advocacy, in supporting them to ensure that patients in their countries have access to the right care at the right time. So also in terms of treatment, there is, simple drugs as hydroxyurea. We all know that hydroxyurea is effective in, reducing frequency of crisis, and also in ensuring that patients stay healthy and improving their quality of life. It's very cheap. You have the generic. It's very, very cheap drug, yet many individuals with sickle cell disease in many of these countries do not have access to this. By GASDO working with these countries, we should be able to get their governments to support bringing these drugs in and ensuring that individuals that need them have access to them. So it's about ensuring there is access to essential treatments. It's about also ensuring advocacy is where it needs to be. It's also about ensuring that they have access to clinical trials. As you know, clinical trials is essential for us to get a viable care for everybody. And currently, you know that with the state of things, almost every pharmaceutical will bring clinical trials to USA or Europe, but they're not going to Africa. They're not really going that much into India. And this is where you have the population. How do we bridge that gap to ensure that even patients in India, in Africa, in Brazil, in this part of the world that have high population, have access to clinical trials, and they are part of the cure? Because the only way we can know how a drug performs is we have the number. We have the right number of people to run the trials on. And this is where you have the families, but they're not going there. So GASDO will help to bridge that gap, even in that area. And lastly, in the area of care providers, we also know that many of the care providers in low and medium resource countries may not have access to the state of the heart guidelines, the current guidelines that are used maybe in Europe or in North America. How do we ensure that even though, for instance, American Society of Hematologists, for instance, may have all these wonderful guidelines, how do we ensure it reaches where it needs to reach? This is part of the work of GASDO to take these guidelines and take it to where it's needed so people can have the right tools to support their families that need to be supported in this part of the world. So we are working with a lot of collaborators, including American Society of Hematologists, Global Sickle Cell Network, which is a network of care providers that are also supporting, care providers across the world, including Africa. And so I believe that with these partnerships, we will be able to penetrate into the barriers that are currently presenting itself, especially in the low and medium resource countries.
Yeah, I think one things that come to mind when you talk about clinical trials and when you talk about guidelines, um, are there any models or any examples of cities, countries, or states that you know of that are actually doing things right? Um, and any examples of people taking adequate steps or taking better steps to get to where the sickle cell community needs to be?
Well, if you ask me in terms of states, and so I know that U.S. many states in the U.S. are doing wonderful work, and our member organization, Sickle Cell Disease Association of America, is doing a lot of great work supporting the many families in that country. Also, our member organizations, in Canada, for instance, Sickle Cell Disease Association of Canada and the Sickle Cell Awareness Group of Ontario, doing a lot of great work in what they do in supporting families. UK also, you have the Sickle Cell Society working closely with the care providers. But again, these are just a few examples, right? There needs to be a better representation of organizations doing great work across the countries. I know Bahrain Society is doing wonderful work as well, and I can tell you in Bahrain, due to the work that is being done in that country, they have drastically reduced the rate of death, mortality due to sickle cell disease in Bahrain. It's drastically reduced. It's just one country that we can emulate in what they are doing. It's in the Middle East, yes, and when they saw the high mortality and morbidity that their patients are experiencing, they did something about it. And now they have very reduced rate of individuals with sickle cell disease. Many countries have guidelines, especially in the high resource countries. And the purpose is for us to take those guidelines that are working for them and take it and use it in other parts of the world. They have to modify it, of course, to what works for them. But at least they don't have to reinvent the wheels. They can start with what we present to them. We can work with them to ensure they have these tools. And where the governments are not listening, we can come in and support their advocacy work to say, this is what this country needs. This is how we can get it done. And we can push the government as a global voice. We will also be working with the World Health Organization, UNESCO, among other international bodies to ensure that we are working in collaboration with the right international organizations in order to ensure that no one, no matter where they live, is lacking in adequate care when it comes to this disease.
Yeah, I think that's great work, and I definitely think if there are more places like Bahrain, research should definitely be done. I want to go back to what you said about a global voice. I see that Gasto is doing the Sickle Cell in My Language campaign on social media leading up to World Sickle Cell Day. Can you tell us about the importance of that when it comes to the different cultural stigmas that are associated with sickle cell disease and how those are expressed around the world?
Yes, so as you know, in North America here, we call sickle cell, and that's what we know. In many parts of the world, especially in UK, and where our English is our first language, sickle cell disease is sickle cell disease. But in many parts of the world, they have other languages other than English, and it's very interesting to note that when you actually translate what they call sickle cell disease, you find that, does that really mean the sickle cell disease? You know, for instance, in some language in West Africa, in Yoruba language, some call it abiku, which is children who come and go. And children who come and go is not really the translation for sickle cell disease. You agree with me? And some also call it aromalegon, which is a disease that hurts the bones. So yes, it hurts the bones, but it also hurts more than the bones. So again, we believe by having this campaign, we are provoking people to think about what they actually translate sickle cell disease to in their own languages and start to think about the stigma that comes with that. So if you call sickle cell disease abiku, children who come and go, there is a stigma. Who wants children who come and go? Nobody wants that. So that when you have a child and you don't, and they say the child has sickle cell, you're already thinking, oh, the child is gonna die. This child is gonna die. But that's not true anymore. We are advancing in treatment. And so children don't have to die. So by thinking about what we call sickle cell disease, we can think about our diversity and also think about the stigma around this. And that can maybe take us to the next level to say, what are we going to do about the stigma? What are we going to do about the emotional implications of what we actually call sickle cell disease in these languages, and how can we help improve on that? So this poster that is worked on by our communication team will be unveiled today, June 17th. And we encourage you to please share the poster widely. Let's know what other people call sickle cell disease in their own languages. And let's learn these words and what this means, the implications, the stigmas. And let's start to think about what are we going to do with the stigmas.
Yeah, I think that's beautiful. When I first heard about the project and when you first explained the project to me, it made so much sense about just the cultural differences of this one disease and how people express it and explain it. I want to thank you so much for being here with me and having this conversation. But what I really want to do is um, give you the opportunity to tell people how to get in touch with Gasto, how to get in touch with Sego, your website, and how to follow you on social media so that they can be a part of this work, and that make sure they know that if they don't have to have sickle cell to be a part and to help your efforts and everything that's going on. So if you could just tell me a little bit more about that and how you guys would like to be reached out to, and kind of what are you guys looking for people to do as far as social media and all of those things?
Wonderful. Thank you, Chadwick. So just before I give you more information about Gaxdor, I also want to mention that this Friday is World Sickle Cell Day, and the Gaxdor will be hosting a global webinar on the current sickle cell disease advocacy work across the world. We'd like you to join us on this webinar. And more information is our website on that, how to register. If you go to www.scdglobal.org, scdglobal.org, you will see the flyer and the link to register to be part of this webinar. For you to connect with Gaxdo, again, you can go to our website. There is a subscription page. You can subscribe to our newsletters to be able to receive newsletters from Gaxdo. You can subscribe to our family network. Again, you don't have to have sickle cell disease. We need advocates, we need volunteers, we need collaborators, we need the community to be part of what we're doing. And we welcome you to join us and be part of what we're doing. Again, you can connect with us on social media. On Twitter, our Twitter handle is SCD Global, just as simple as that, at SCD Global. And on Instagram, we are at scd.global. Global, scd.global. So feel free to connect, tag us, share with us, retweet our tweet, and help spread the word. It's all about us, and it is for us. So let's spread the word. Let's make GASDO work, and it will work. I want to thank you again, Chadwick, for the beautiful work that you're doing at the Conquering the Curve. And it's just amazing that, even without you having sickle cell disease, you have done so much to support this community. And I think it's individuals as yourselves that this cause need to move it forward. Thank you.
Thank you again so much for being with us. We are going to do our best to press out the conversation that is going to be had on Friday, which, as you said, and it can't be said too much, it is June 19th, World Sickle Cell Day. It is an opportunity to learn, to find out more, and hear about these conversations going on in the sickle cell community that need your advocacy and that need your help. So thank you, Lanre, for joining us. Thank you, audience, for joining us. I hope you all have a great day.
Thank you. Thank you, Chadwick.